Welcome to USA Breastfeeding Guide. Today, we're talking about breastfeeding in the first 24 hours after birth, what to expect, what's normal, and how to get off to a strong start. The first day after your baby is born is a time of huge change for both of you. Your baby is learning how to live outside the womb, and your body is beginning the process of making milk. Those first 24 hours are not about perfection. They're about connection, comfort, and practice. Right after birth, if possible, place your baby skin to skin on your chest. Skin-to-skin contact helps regulate your baby's breathing, heart rate, and temperature, and it naturally encourages your baby's instinct to breastfeed. Many babies will begin showing feeding cues within the first hour, such as licking their lips, opening their mouth, turning their head, or bringing their hands to their mouth. This first hour after birth is often called the golden hour. During this time, many babies are alert and ready to latch. If your baby breastfeeds during this period, that's wonderful, but if not, don't worry. Every baby is different, and there will be many opportunities to try again. In the first 24 hours, your body produces colostrum, a thick, yellowish milk that is packed with nutrients and antibodies. Colostrum is often called liquid gold because even small amounts provide powerful immune protection for your baby. Your baby's stomach is very small, about the size of a cherry, so they only need tiny amounts at each feeding. It's normal for babies to breastfeed frequently during the first day, sometimes 8 to 12 times or more in 24 hours. These feedings may feel short or irregular, and that's okay. Frequent feeding helps your baby learn how to nurse and signals your body to begin increasing milk production. When your baby latches, you may feel pulling or tugging, but breastfeeding should not be painful. If you feel sharp pain or pinching, gently break the latch and try again. A deep latch, where your baby takes more than just the nipple, helps protect your nipples and allows your baby to get milk more effectively. In these early hours, your baby may be sleepy, especially if medications were used during labor. If your baby is very sleepy, try gently waking them by changing their diaper, unwrapping them, or placing them skin to skin. Talk to your baby, touch their feet, or express a few drops of colostrum onto your nipple to encourage interest. It's also completely normal to wonder, is my baby getting enough? In the first 24 hours, wet and dirty diapers are one of the best signs. Many babies will have at least one wet diaper and one bowel movement during this time. Healthcare providers will also monitor your baby's weight and overall condition. Remember, breastfeeding is a learning process for you and your baby. You do not need to do it alone. If help is available in the hospital or birth center, ask for support from a lactation consultant, nurse, or trained breastfeeding professional. Early guidance can make a big difference in comfort and confidence. Most importantly, be gentle with yourself. The first day is about bonding, rest, and getting to know your baby. Trust your body, respond to your baby's cues, and take things one feeding at a time. You're doing something amazing, and this is just the beginning. Thank you for watching USA Breastfeeding Guide. If you found this helpful, support the channel and join us for more breastfeeding tips, guidance, and encouragement for every stage of your journey.